So let's talk about these types of gut dysbiosis and how we typically have gone about treating them. Because when we look at our next lesson, when we look at best practices with our products, we're going to focus more on a microbiome targeted approach to those. So the first type of dysbiosis is when we have any sort of overgrowth of bacteria. And typically we get concerned when there's an overgrowth of pathogenic bacteria. In the past, antibiotics were the gold standard for dealing with pathogenic overgrowth. And antibiotics do have their role and necessity, but they're not selective and can unfortunately do a lot of long-term damage. So with microbiome medicine, we're going to be looking at ways to reduce those pathogenic microbes while supporting and maintaining the gut. The second type of dysbiosis is when a patient is missing key beneficial microbes. And a lot of times our first thought in these situations is to reach for over-the-counter probiotics, which do provide benefits, but don't contain the microbes that are native to dogs and cats. So when we look at best practices later, we're going to be looking at products that have microbes that are species specific. And the last type of dysbiosis is when the microbiome is out of balance and we start to see those outward clinical signs, but we don't know how to truly address the cause unless we perform some sort of microbiome analysis and understand what is healthy. So again, antibiotics are the standard we usually reach for when we're treating acute diarrhea. It's what we were all taught in vet and tech school. However, we are noticing that there are high relapse rates. In studies, they found there's a reason why it's called Tylosin-dependent diarrhea. 88% of patients within 2 months of stopping Tylosin, they return to the clinic with the same clinical symptoms of chronic enteropathy. With metronidazole, it's 100% of patients who return within 6 to 12 months. So we do a really good job with our old standard of care of really getting that inflammation initially under control so that our clinical symptoms resolve. But obviously, we're leaving something behind that's causing the trigger of a relapse and that medical merry-go-round. So Texas A&M wanted to look at what could be occurring that's causing these relapses in these patients. They did a clinical study using patients with acute diarrhea, separating them into two groups. One group received one rectal FMT enema. The other group received the standard 7 days of metronidazole therapy. Now, over these 28 days, they wanted to see clinically how everyone was doing, but also what was going on with their gut. So they used their dysbiosis panel to kind of check certain points within this 28-day study. Now, what they found clinically is the first 7 days, everybody, whether they were an enema group or a metronidazole group, showed improved consistency in their stool. However, as the study drew to a close around day 28, they noticed that the consistency was still holding up well with the FMT group, but now the metronidazole group was having some waxing and waning symptoms. What they found at the end of this study is that overall, the FMT group maintained their good consistency throughout that 28 days. And the reason for that is overall, their gut balance was closer to that of the healthy control by the end of the 28 days. And they did not have pathogenic E. coli overgrowth, which was what was noted on the metronidazole cases. The second type of dysbiosis I said can occur when we're turning to probiotics in order to kind of replenish a gut that's missing key beneficial microbes. So after antibiotic exposure, typically there's 3 methods in which we can restore the gut to its natural balance. We can use standard bacterial probiotics. We can use native bacterial probiotics, which is FMT, or we can basically sit and let the gut heal itself, which in a fancy way is called spontaneous recovery. They've actually done studies in this area, looking specifically at humans and mice and seeing when we have these patients who we wipe their guts with antibiotics for 14 days, what is the best way to restore the gut to a better state? Now, with this chart, you'll notice that there are 4 lines. The gray line is the control group who was never exposed to antibiotics during this 50 days. The other 3 colored lines are actually going to represent the groups that received FMT, the groups that received standard probiotics, and the groups that were allowed to heal on their own. That first grayed out section is the 14 days in which antibiotics were administered. So as you can see, during this time period of days, they were also measuring how many bacterial species were in the gut. And you can see all three colored lines take a dive in that 14-day period. Now, the group that bounces back the fastest and restores the fastest is the FMT group. They get really close to almost the control group around day 40. The second fastest way they found to restore the gut to its natural state is the orange line, and that orange line is spontaneous recovery. So the group that received absolutely nothing, no probiotics, no FMT, they were the second fastest way to heal the gut, which left that green line, the probiotics, as the slowest way to restore the gut after antibiotics. Now, it wasn't because the probiotics were doing any harm. They weren't. Probiotics are meant to come in, help with inflammation, help modulate, and leave. However, probiotics are bacteria, much like the native bacteria in the gut, which are already at a low number. So when we use probiotics, we're basically using those bacteria to use the nutrition that's coming into the patient. They may overwhelm the adhesion sites that the native bacteria need and able to actually proliferate and grow. So probiotics can really slow down the restoration process comparatively to other methods. And like I said, the last type of dysbiosis is hard to see without doing any sort of diagnostics on the gut. And in this case, a lot of times when we see these out of balance microbiomes, it isn't just GI symptoms. A lot of times it can be skin. And so this is a study that was actually performed in canine atopy patients who were put through the ringer in order to be in this study. So they had to be allergy tested, have blood work, had to be screened for all internal and external parasites. Plus, if they passed through those hoops and hurdles, they were placed on an 8-week hydrolyzed protein diet. So this researcher wanted to see what is that connection between what's going on inside the gut microbiome when these patients come in red and inflamed, like this pup on day 0, and when they're starting to show healing of the skin, which is seen in day 28. So what this researcher did is, again, day 0 is after 8 weeks of hydrolyzed protein. He placed these patients on FMT capsules, 1 capsule BID for 28 days. He also checked the gut health on day 0 when they came in looking sad and itchy, and day 28 when they were on the healing path. And though what he expected to see in a lot of these patients was overgrowth of pathogenic species, he really didn't see that. These kiddos had all the right key bacteria within their gut microbiome. They just needed a little bit of a shift. So by adding FMT into the mix, he was able to help reintroduce the proper bacteria and help shift the balance of the gut so that those bacteria then produce the byproducts that impact the skin and improve the skin. There's a lot of good research in mice and humans and dogs looking at the benefits of a properly balanced gut using FMT to help with a lot of these skin cases. When we're looking at these types of dysbiosis, we had our own standby of what we usually would choose. But now we're going to think about things a little differently and look at it through a microbiome targeted approach. So when we have the presence of overgrowth of harmful microbes, well, now we're going to think, okay, how can I support the gut? How can I maintain the gut? And how can I also reduce and specifically target pathogenic overgrowth without choosing antibiotics, which will just be a nuclear bomb on the gut? When we're dealing with missing key beneficial microbes, this is when we think back to what they taught us in school, that cats are not small versions of dogs. So we want to provide beneficial products with the native microbes that are specific to cats and dogs, like FMT. So while probiotics do have their place, FMT can be more beneficial for a lot of these patients. And when we have a diverse microbiome that's out of balance, again, we may not know this without testing, but we can see these sorts of imbalances and this sort of dysbiosis in patients who are not showing GI clinical signs. In our next lesson, we will be looking at the best ways to approach these types of dysbiosis, looking at our products and our testing. So our next module, Clinical Approach to Microbiome Medicine, will go over best practices of the supplements we have here at Animal Biome Veterinary. We will also go into our testing, how our donors are screened, and the best ways you can approach clinical medicine with your patients.